growing up, the best thing they do as far as dental work, they give you a little pink pill. If it showed any areas on your teeth, they would determine to take them out. They didn't save teeth back then. Penny candy as it was back in the day, didn't realize that the caramel was sticking to my teeth and it was wearing down the enamel. I didn't know things like that back then. In terms of staying honest, my sister and myself, with our dental care, the main thing was to go to school.
I think he was eating some Raisin Bran one morning. He went to bite and chew and he hurt himself and he was like, oh man, I can't do this no more.
He would not get too close to anyone because he didn't want to be in anyone's space. He always hugged you from a distance.
It explains why he never smiled and his grandkids be like, Granddad, how come you don't never smile? He went, what do you mean? Don't eat no candy.
In terms of being that bright, vibrant person that's always got a smile beaming across their face, I've never lived that life. And when I was out there drugging and using, I was a happy-go-lucky person, but still in all, I wasn't always up in the camera's eye. People would take pictures, I'd move away. First time I saw this picture again was one of my cousins, and she said, can you see yourself in the picture? And I said, well, I don't know. I never knew that I could open my mouth that wide. I wanted to go to Vietnam. A lot of guys in high school then were dropping out going to Vietnam. Their mom would sign them up. My mother wouldn't do it. A buddy of mine, he said, well, we can go in on the buddy plan. This is going to straighten me out. This is going to get me on the path to the right thing. I said, okay, we'll both get X amount of dollars after we sign up. I showed up, he never did. I went ahead and shipped out.
Kent is now back in the community, working at the VA. He was military, police officer, lost his job, became homeless. Now he's an ex-homeless, working at the VA, and it's a pleasure to give him his teeth back. He lost all his teeth were pulled, and he is now functioning with a denture, which means he's functioning with 15%. He's a big guy, and he likes to eat. So in order to get him back to function, at this program that we're doing, we're gonna give him 6 implants up top, 6 on the bottom, and we're going to fixate his teeth so he's back to 100% function.
Dr. Joe invited Dustin and myself to come down to Arizona to Brighterway Smiles to help him out with his Veterans Day service. He was looking to do a full rehabilitation, upper and lower arches, and that's what we were able to do today for our veteran.
The benefits of this procedure is that, without teeth, life is a little grim. Can't smile, can't chew, can't talk very well, and we pretty much changed his smile and changed his life, and it was awesome.
We are here to transform lives of our veterans and our homeless veterans. We started about 16 years ago in a small trailer, and our goal was to give ultimate care to our homeless and our veterans.
Dentists can come to Phoenix and place implants on homeless veterans and the homeless with a 2-day customized course that's based on your needs.
There are no other places in the country that provides this kind of treatment. There are other training programs out there, but to be able to touch somebody's life, to give a smile back, it doesn't exist. We have thousands of patients that are homeless, the veterans, the underserved, that need this care. So in order to do a live training, you need patients, and we have the facility, the capability, work with the medical group on site, social services on site, with the housing, so make sure that they can get their work done, but they have aftercare. So no, nothing like this exists in the US.
And by you coming here, placing implants and placing restorations, you're transforming the lives of veterans. And that's my whole goal.
I don't feel so self-conscious that people are looking down my throat and can see what damage I've done through my life. I am impressed with what was done. Didn't know that this would be done 4 or 5 years ago, but here I am right now, and it works. I had the procedure done on a Friday. That Monday I was at work, no problem.
just, you know, getting out there, just putting your effort in to go to the dentist and ask them, you know, what can you do? Can you correct this? And 9 times out of 10, like myself, they're gonna fix you. They're gonna get you right again.